Welcome back to the Morning Blend with our continuing series, Insurance 101. Well, we've talked a lot about kids and learning throughout the show today, but what if you don't know much about Medicare? Deb and Jerry Dornbush join us now from Silver Supplement Solutions, a Sovereign Select approved company, to explain some details about Medicare. Good morning, guys.
Good morning, Tiff. Thanks for having us back.
Oh, good to see you too. I love you too. You're one of my favorite couples that we have here on the show. So, today we're talking about the fact of people really understanding Medicare. I bet that you find that a lot of people don't really get it.
Yes, they don't seem to understand the different parts of Medicare, when to sign up for them. They don't understand that there's multiple parts to it. There's Part A, which is your hospital coverage. Part B, which is your doctor's office and medical durable goods that it covers. C, which is a combination of Part A and Part B, and Part D, which is your drug coverage. The Part C is a Medicare Advantage program, and there's also a Medigap component that can be added to it to help with coverage.
So basically, after the four parts, some people choose Part A and Part B. Now, Part A, if you've worked 40 hours, 40 quarters in your lifetime, which is about 10 years, you're entitled to Part A at no charge unless you make over six figures every year. Then there is a charge for that. Part B is $144.60 a month. A lot of people don't know that until they think everything's going to be free. So $144.60, and that can be higher too if you make more money. So those costs, everybody's going to pay pretty much at least $144.60 unless you are below poverty level. Then things change. So then we go into, you've got A and B, now you need a drug plan. So a drug plan is going to cost additional money every month. And with Medicare, A and B, they usually pay 80% and you pay 20%. So some people elect for a plan called Medigap. And there are several different options they can choose from. And those options have a cost attached to them as well. So then we go into Medicare C, which is Medicare Advantage. And this option is inclusive. So you're still going to pay $144.60, but you can actually have a $0 payment every month that picks up those extras for you. So this is Medicare C at Medicare Advantage plan, and it covers your hospital, it covers your doctors, and it covers a drug plan. So there's going to be co-payments. So how we describe it to our clients is pay as you go, which is what the Medicare Advantage is, or prepay. And people have that option. So that's pretty much it. Medicare Advantage do offer other incentives because Medicare Advantage plans are growing every year. More companies are adding them. So they'll do free gym membership, transportation, some dental, some ear hearing aids. So yeah, it's very complicated for each person that doesn't have any experience with it. So what we try to do is help them determine what's important to them and then show them options.
Well, I think that's what people are going to hear is with all these parts, it can just get so expensive. And that's what people are probably so afraid of, right, Jerry?
Right. It can get pretty expensive, especially if you don't truly understand what you're signing up for and decide to do it on your own. You may not have all the coverage that is available to you, and you may be paying more for it. So what we do is we go through everybody, because everybody's needs are different. There's no two people that have the same needs. So we custom tailor what plan, what worked for them, what's the best coverage. Somebody who has some serious health issues, serious medicines, may be better with a Medigap policy versus a Medicare Advantage policy, because some drugs are very expensive and depends on how they're covered.
And
So
you know,
we
we're
do.
running out of time, but I want you to go through, Deb, because what you guys do is free for people. When you sit down, you go through all this, you find out what works for them. With everything opening up, because you've got these educational classes, are you guys doing actual events in person yet? Because I think your clientele is probably a little nervous about that.
Well, actually, we've been meeting people in person at their homes or in coffee shops. We wear masks if they would like to. And that's what we've been doing, wearing masks. But we also still do over the phone. We can Skype, we can Zoom. And so there's so many options out there today. But the most important thing is for people to get the education so they understand when it's time for them to get Medicare, they can make an educated choice.
Absolutely. You guys are so great. And I want to make sure everybody's got the information, because these educational seminars that you have are educational only, but people can learn so much from you. So I'm going to give that information. Thanks for joining me today, both of you.
Thank you.
Thanks, Tiff.
Absolutely. Silver Supplement Solutions is holding these two educational webinars. It's Friday, July 17th. Okay. And here are the times. There's a 10 a.m. and then another one the same day. It's at 6 p.m. Silver Supplement Solutions has multiple ways to connect with you. They mentioned Skype, Facebook Live, YouTube, Zoom, over the phone. They'll meet with you in person at a coffee shop or at your house. You can go to their website. It's silversup.com, or just call them. Again, it's free. 262-728-9311.